Hello, I'm Lesley Ogden. I'm the CEO of Samaritan North Lincoln Hospital in Lincoln City and Samaritan Pacific Communities Hospital in Newport. So we are critical access hospitals, and our mission is to build healthier communities together officially, but realistically, our facilities provide necessary care, emergent care often, for people in our smaller coastal communities, and they're absolutely necessary for the development of everything that we think about in vibrant towns and cities. You have to have medical care, and that's what we're doing. As critical access hospitals, we are required by law to have certain things, and one of those things is emergency care. And so that's, I think, the hub of what people can count on us for is if they have an emergency, we have emergency departments staffed with residency trained and boarded emergency medicine physicians and advanced practice providers. And so they can count on us for that. Beyond that, though, we have a litany of things that we offer. Certainly, most people know we have inpatient care as well, and that is a med-surg level of care for generalized hospitalizations and after surgical recoveries and things like that. But we also have intensive care units. So if someone is more sick, we can take care of them at that higher level of care as well. We have a smaller number of beds dedicated to intensive care, but we also can utilize those inpatient beds for standard med surge level care. So we have a lot of flexibility with how we make ourselves what our community needs us to be. So, but beyond that sort of inpatient care, we do have surgical services, which I mentioned, and most of what we do in a critical access hospital is elective surgeries, but occasionally we do have emergent surgeries, and we do have all kinds of different surgeons that are a part of our medical staff and are on call for things like general surgeries, OBGYN surgeries, orthopedic surgeries, urologic surgeries, and that's sort of the bulk of what we do. Further, we have all kinds of outpatient services as well. And in fact, what we do the most of, probably 90 to 95% of what we do is actually outpatient. But most people don't know hospitals in that way. They associate hospitals with the inpatient side of things. But on the outpatient side, we have all of the things that someone would associate being at the hospital, like lab, imaging, and we have expansive imaging, everything from ultrasound and bone scans to CTs and MRIs. We also have echocardiography and things like vascular studies as well, really hoping that people use us as their diagnostic center, meaning we might not be able to be their specialists in everything, but we hope that they don't have to leave their community to get a diagnosis, to figure out what's going on with them. And we try to provide all of those services. And then, of course, thinking about clinics and all of the outpatient and ambulatory care that we give. And so that can be everything from what most people associate with primary care to cancer care. We have oncologists, to cardiology, because we have those specialists, to even wound care and infusion care. We have all of this available. We also have endocrinology that is now coming in, and we're soon going to resume infectious disease as well. So all kinds of specialists that come to us, and then we can have those appointments available for people right in the area. So some of the things we've been working on are really listening to the community and what is community need. And so one of the first things that we've done quite recently is open a pharmacy in Lincoln City at our campus, at our hospital campus. And one of the reasons for that, because this is our first pharmacy in Lincoln County. And one of those reasons, though, is because we've seen Bi-Mart close. We've seen Rite Aid become sort of more and more unstable with their nationwide offerings. We've seen Safeway with lines out the door, and we've seen Walgreens closed at various times where their pharmacy just wasn't available because of staffing issues. And so we've heard over and over again from folks in our community, we don't have the pharmacy services that we need in the north part of the county. And so that's why we chose Lincoln City. We're keeping our eye on the remainder of the county, and if the need is there, then we'll respond in the same way. We certainly don't want to chase out of town any of the pharmacies that are already here, especially the smaller ones, the mom and pops, and the ones that have kept us going, for so long. But certainly we can't allow our healthcare infrastructure to crumble. And that is one thing that we do have the expertise to do. So we'll continue to keep our eye on that. Another thing, as many people are aware, is we've been keeping our eye on substance use disorder. And we've seen an uptick in deaths, of course, related to fentanyl use. Those types of opioids that are out there can now be bought very easily in pill form and are uncontrolled, and oftentimes just with one tablet someone can die. And so as we see the nature of what's out there and what is addictive to people changing, we need to answer that with further resources for treatment, because ultimately so much of opioid use in particular, but a myriad of drugs and alcohol are so addictive and they're so disruptive to people's lives. And we are currently building an inpatient treatment facility in Lincoln County just for that. We'll offer outpatient treatment as well. We have to make sure we take care of people as they're coming into us, as they're inpatient, and as they go out. We'll work in conjunction with the outpatient treatment programs that are already here and offer, we hope, a lot of services that are very particular to different groups, whether it be tribal groups, whether it be our LGBTQ plus community, really making sure that everyone feels welcome as they seek treatment. An inpatient facility, ideally not 300 miles away or something, just impossible. And so hopefully this is a real changing point for our communities. So those are just a couple of examples of things that we're doing. And then the third I would highlight is our robotic assisted surgeries that are taking place in Newport. And that is a new program that has been in place less than a year, but it has brought the ability to have surgical types of procedures done on a patient's abdomen. So that might mean general surgery, it might mean a urologic surgery, or an obstetric or gynecologic surgery done with the assistance of a robot. And what that can do is it can make a little bit safer surgery just through more concentrated cuts. It can decrease blood loss. And for some very difficult surgeries, it can actually improve visualization of the surgeon, and not to mention preserve the surgeon a little bit as well, because instead of being over a patient, they're actually at a console guiding sort of robotic arms. So we have that, we're using that, and it has been quite popular. We know that as we hire new surgeons coming out of their training, they have this training, and so they'll be able to use this equipment as well. So those are just some of the things that are going on, that we're trying to enhance the services that we already provide and provide something new and beneficial to our communities. I think I would build more oncology services, things like a radiation facility. we have so many folks that live amongst us that are half of the people who live here are age 50 or older, who are permanent residents, and that means to some degree we probably have higher incidences of cancer and types of disease processes that we see, towards the end of life. So I would love to see us have more facilities for patients so that they would not have to travel outside of our area. Gosh, I'd love a cath lab and everything else to take care of, everybody's vascular situations as well. The reason we don't have these types of things right now is because even though we do have 50,000 of us in the county and half of those are age 50 or older, still by the time you get down to the number of patients who actually have cancer and require radiation therapy, or the number of people who have cardiovascular abnormalities and actually require cath lab, it's in the single digits sometimes. And so that's why it isn't quite, we aren't quite able to do that kind of work and support it, in the way that is necessary right now. But if I had unlimited funds and I could just do mission-driven work, that would be amazing to really bring so many more services to our area. I think I'd buy a couple neurologists as well, and so many of the specialties that are difficult to have anyway, even in urban areas. That would just be lovely. Well, we support the economy through so many different ways, from the start being an employer, of note. And I think you're right. I think we're third now behind the casino and the school district. But beyond that, I mentioned earlier that healthcare is necessary in order for places to grow. You can't really attract a growing city can't attract people to come to it without having healthcare resources. We talk a lot about people making very careful decisions as they retire, and they're always looking to see what are our healthcare resources in the area. But if we're just looking at economic development alone, that is even more particular for people who might be coming in and might be wanting resources for their family, or if they are bringing their own specialties, whatever that may be, to the area, having specialty services that might fit their needs. And so things like having more technology available for those people who might not want to call and make an appointment, for having ways to see what the wait times are at in our different areas. Things like that are things that we have in place or are putting in place to really make sure that we're going to keep up with the growing economic development needs, so that whenever someone says, oh, I want to come to Lincoln County and bring a business, or bring my family or start something new, that healthcare is not a reason for them to ever say no. I would love to help them make decisions on where to go for their healthcare at the right time. I would love to be able to tell people, there are the right times to go to the ER. That is for sure. If you are experiencing chest pain, if you have difficulty breathing, if you are experiencing problems with speech or moving your body parts, or something along those lines that might indicate stroke, all of these types of reasons, horrible pain, these are all reasons to visit your friendly neighborhood ER. Absolutely. I would love to help people, though, decide that maybe the ER isn't the right place to go for a cough or cold or some other types of everyday things. And we have other resources available, like our urgent cares. And then I think it is important for people to understand that they may not need healthcare services when they're younger, but as we age, we do need those. And some people struggle to understand the reasons for a primary care provider that may coordinate your care amongst all the different places that you might need to go. But certainly as we age and or if we have chronic conditions, a primary care provider is really necessary. And if people have that in place before they get into a situation where they need it, it's a lot easier, because we do have a shortage of healthcare providers in our area, as well as dental providers and mental health providers. We're just in a shortage area for everything. So, so doing things ahead of time, being prepared. We always talk about being prepared for the Cascadia event or the, whatever natural disaster might occur, but being prepared for your healthcare journey as you age is equally important. And especially in rural areas where resources are not as readily available as they would be in an urban area, being prepared pays off. Ooh, yay, I love that one. Tons of ways to support us. I think one of the simplest ways is just keep up with what's going on and what's changing. And that's as easy as subscribing to, social media, join our Facebook group, or follow us, on Instagram, or, whatever your thing is, just to keep up with the news of things that may be happening or changing, with healthcare in our area. But if people want to get involved, we have a number of ways to do that. First of all is our volunteers. And I know people can remember the old candy stripers of yore, in hospitals and things like that. We're much more advanced now, and but in our hospitals, you will see our volunteers greeting people as they come into any of our entrances, really being a part of the dynamics and doing things like running gift shops and things along those lines. So, so volunteering is one way. We have hospital board of directors as well as foundation board of directors, and that's another way. If they're passionate about healthcare and or they have money to give, getting involved with our foundation is very important. And that can be just serving on a board and deciding how best to spend the money that has been donated, or if you want to make a donation and to a special service or group that is within our organization, that can be done as well. And then we always just love to hear from people, and especially if they got great service, if they have someone to thank. We have ways to get those thank yous directly to the people who need to hear them. And so we always appreciate when people reach out and just tell us how we're doing, good, bad, or ugly. Because if we're not getting something just right, we want to know. But certainly if we did get it right, we want to make sure that your healthcare provider knows that and gets those kudos.